Everyone. So we'll restart this live session at 9 p.m. So the question was on optic neuritis. What was the question actually? One second. So I think the question was to figure out the false statement regarding optic neuritis. So let's discuss the question before I discuss a few more points which are very, very important for optic neuritis. And with your upcoming INI set, this assumes a lot of significance because optic neuritis is a very, very, very important topic, so to say. Okay, so the question was identify the false statement regarding optic neuritis. I remember one option was the color vision and contrast sensitivity are decreased in proportion, okay, to the visual acuity. Then there was an option which said normal fundus findings, and there was an option which talked about only oral steroids is going to increase the risk of recurrences, or no, it's contraindicated. Only oral steroids are contraindicated. Then another option, I don't have the question list with me. Guys, any of you can recall the other option in the original question? What was the other option, guys?
Today's EyeQuestion is about an important topic, optic neuritis.
Wait, I'm watching my own. Where is it? Oh, what is it? Yeah, pain on eye movements. Okay, so pain on eye movements was option B. So let's go over it again. So color vision and contrast sensitivity are decreased proportionately. No, they are decreased out of proportion to the visual acuity. See, how much ever is the visual acuity? Suppose there is let's say a 2x decrease in visual acuity in optic neuritis. The amount of decrease in contrast sensitivity and color vision is way more than that. So that is the actual false statement. So it is decreased disproportionately. Okay, so we already got the answer. What about option B? Pain on eye movements. Yes, it is a true statement. You do get pain on eye movements. In which particular subtype? You get it in retrobulbar neuritis, subtype of optic neuritis. And option C, normal eye fundus findings. Yes, in retrobulbar neuritis, you do get a normal fundus findings because the portion of the optic nerve that is involved is behind the lamina cribrosa, posterior to the lamina cribrosa, right? So when you're looking at through the ophthalmoscope at the fundus, all that you get to see is the optic disc, which is the intraocular portion of the optic nerve, which is absolutely normal in retrobulbar type of neuritis, which is the most common subtype. Now the last option, only oral steroids are contraindicated in the management of optic neuritis. Yes, you should not give only oral steroids. You should give initially IV methylprednisolone high dose followed by oral prednisolone, because if you only give oral prednisolone, the risk of recurrence is very high. And with every attack of optic neuritis, the patient's vision, ultimate vision is going to reduce. Okay, so that again is a true statement in this particular question that I had posted. So let's discuss a few more things about optic neuritis. Are you ready? Now, number one is, let's discuss a few things about epidemiology, because that comes as true or false statements. It's quite common in females. And what is the ratio? 3:1. Okay, 3 times more common in females. And what is the age group of the females? 20s to 40s. Okay, so this highly productive group, 20s to 40s females is the one which is most at risk. Yes, so in your clinical STEM you will find this kind of a female 30-year-old, 22-year-old, 25-year-old. Yeah, and the most common cause of optic neuritis, as you all know, is a demyelinating disease, multiple sclerosis. And the most common subtype also, which is, again telling time and again, it is retrobulbar optic neuritis. Now what else I wanted to tell you was, now these percentages are very, very important because I asked this in the previous INI CT. Now the percentage, remember there are two numbers that you need to know. One is a 50% and another is a 30%. Now 50% is simple, guys. Anybody with optic neuritis, how many of them will get optic multiple sclerosis? 50% of them will eventually be diagnosed of multiple sclerosis. Similarly, multiple sclerosis patients, how many of them will develop optic neuritis? Again, 50%. Okay. So either ways, optic neuritis in a multiple sclerosis patient, 50%. Multiple sclerosis in an optic neuritis patient, again 50%. Now, what is this 30%? See, optic neuritis is an initial presenting feature of multiple sclerosis in 30% of patients. Yeah. So, it can be an initial presenting feature in multiple sclerosis. What? Optic neuritis in 30% of cases. Is that clear? So, this is the 50% and 30%. So, we've got three statements based on this. So, these can be a true or false statements. Now, chronology, Sanjay. So, we'll talk about that